For my practicum, I chose Campus Chiropractic, a chiropractic therapy and injury rehabilitation center located on the MMC campus of FIU, right underneath Parking Garage 6, with one other location located in Wynwood, to which both are owned and operated by Dr. Richardson Parisi, who is the main site supervisor for the location. Their hours, they are open Monday, Wednesday, and Friday from 9:30 a.m. to 7 p.m. and 9:30 a.m. to 1:30 p.m. on Tuesdays, to which they are closed on the weekends and Thursday. The schedule for me was for 2 full days on Monday and Tuesday, with me finishing at 1 p.m. during the Wednesday days. The reason I chose this location is because not only is it closer proximity to my home, but it was also under the physical therapy tag for the practicum. And I wish to not only receive a letter of recommendation from this location to help me pursue a increased education with a doctorate program here at FIU for physical therapy, but to also allow me to have a glimpse of what it was like to work in a therapy type location while also communicating with the clients and patients, as well as a brief look at what it was like to use any of the type of therapies and machines that they have. When you step into Campus Chiropractic, you'll see the front desk, where here you'll talk with one of the employees, D. Madi, who will help you sign any paperwork if you're a new client, help with insurance verification, as well as help set up any type of future appointments. And while you're waiting here for your appointment with a doctor, you may even check here for any of the vitamins or comforters that you may see at the front office in order to place an order for them. Within the main treatment room of Campus Chiropractic, I held several responsibilities in order to help clients be ready for the adjustment appointments with the doctors. One of the responsibilities I had was that for some patients I would help set them up on the traction table, to which this table with moving parts would help increase the mobility of the individual spine as they laid down with leg supports. One of the things, though, I had no responsibility for is that if any stretches or exercises were to be required by the patient, they're then given several balls, mats, resistance bands, and other workout equipment in order to help with this if they are so told by the doctor. One of the other responsibilities I held was that after the traction table, I may bring the client over to an EMS machine, or electric muscle stimulation machine, in order through the use of these stim pads to connect them to the machine and place them on where the patient claims that their body feels the most sore, to which an electrical vibration sensation would be sent through onto the patient based on their comfortability level, in order to help control muscle spasms, re-educate muscle, and even regenerate the blood flow circulation within the body. And if they so choose to, I may even provide them with a heat pack to help to bring some type of warmth onto them. My responsibility was not only to set them up for the EMS machine and provide heat packs, but if needed, they may also be subjected to an ultrasound heating, to which through the use of the wand on the right of the machine and a type of cooling gel, they'll be able to be given some type of heat sensation on the part of the body that is needed in order to help reduce inflammation, warm up the muscle, and to help them relax. Afterwards, they will be brought here to where the doctors, Dr. Cece, Dr. Richardson Parisi, and Dr. Tyler, would then begin their readjustments in order to help decrease their feelings of pain, increase their mobility, and to increase their quality of life. They may do this through certain physical means, or may even use tools such as the muscle gun, to which helps smooth out the muscle, to when if there was another patient and only one doctor, I would then be given the responsibility and be called in order to help provide this vibration gun in order to use it on the patient while the doctor works on another. They may even use an activator, to which its main purpose is to be able to move bones slightly and to break open muscle knots within the patient. All of this was taught not only by Dr. Cece, but mainly by the campus chiropractic assistant, Madi, who was able to help me understand all of this and was able to provide me a brilliant explanation on how to perform these. One of my other responsibilities as campus chiropractic, if a new patient were to come in, I may take them back here to this chair in order to be able to take their blood pressure reading for papers. Good afternoon, this is Dr. Cece with Campus Chiropractic. So Dr. Cece, so what is your title here at this location?
Sure. My name is Dr. Cece, that's short for Dr. Crystal Chancellor, and I am a chiropractic doctor here at Campus Chiropractic at FIU.
For your title, so what is that? So what does that entitle when it comes to your work? What do you do with the clients or patients that come around?
Sure. I help people with their pain. So we treat a number of different patients here: personal injury, general insurance, cash, wellness. We treat patients with all levels of pain, from neck injuries to sciatica, low back injuries, mid back injuries, foot pain, everything. So I use my bare hands and I turn different bones to relieve their pain. We also do a number of physiotherapies here, which I know that you help out with, Mitchell.
That's correct.
And that's electric stimulation, ultrasound, mechanical traction, physical therapy, different exercises and stretches, as well as massage therapy, trigger point therapy, manual therapy. So we do a few things.
What would you say is the reason that you went into this line of work?
Sure. I love helping people. I had a chiropractor that changed my life. And I decided that that's what I wanted to do. I wanted to help people as well.
All right, then. Thank you, Dr. CC, for your time.
You're welcome. Thank you.
In this location of Campus Chiropractic, we have the back office, which is where clients can come for readjustments, but also mainly for massages provided by one of the employees, Jasmine, who is not only the office manager, but a licensed massage therapist who can provide things such as deep tissue massages, muscle scraping, and even suction cups to help with clients in order to be able to ease the muscle pains, stresses, and other such things. Here at Campus Chiropractic, you would work under Dr. Richardson Parisi, and for when he's not here as a site supervisor, it would then be delegated to one Dr. Cece or Dr. Crystal Chancellor. Both of them, besides being the site supervisors, depending on who's present, are extremely easy to talk to. And in terms of any insights, they're really easy to talk to, really well. Communication with them is very well and very possible. And in terms of talking to Dr. Rich, when it comes to any of the schedule changes or anything that may be required, don't be afraid to say anything, because he is very easygoing and really easy to talk to. As both Dr. Rich and Dr. Cece, they both help with the readjustments of the clients, with the main purpose of the fact that they both get a sense of satisfaction being able to properly help people in order to help improve their health and their life. Dr. Rich does run both Campus Chiropractic, so sometimes he may not be here, but when he is very well spoken, easy to communicate. And honestly, if any changes need to occur in one's own schedule or anything new comes up, it's all right to discuss with him any of these things. Just make sure to give a heads up before any of that may happen. And while here, I learned that with Dr. Cece, she was able to become a chiropractic doctor due to a certain experience in her life, allowing her to realize the importance as well as the positive effects a proper chiropractic doctor can have on a certain individual. And in terms of what I learned here at Campus Chiropractic, I learned three main things. One is how to have proper communication with clients and patients. But the main goal is to help keep a sense of formality and professionalism with them, but at the same time also being able to have a casual conversation in order to make them feel most comfortable as you work with them. I was also able to learn different modalities when it comes to chiropractic therapy, specifically electric muscle stimulation, ultrasound, and as well as getting a glimpse of when it comes to exercises and other stretches that the doctors may have clients perform. So allowing me to do this allowed me to better understand certain modalities of chiropractic work and injury rehabilitation. For there have been personal injury clients who went into car crashes or falls, general clients who pay with card or insurance, specifically insurance, and regular clients who play with cash or card completely. Not only did I learn modalities as well as communication, but I was also able to have a small glimpse of what it's like to properly submit documentation for a client when it comes to any medical or insurance purposes. For my reflection, I just want to state that overall my experience with the location has been just overall positive. Everyone there at the location was extremely supportive of me, and they were all easy to talk to, from the employees to the doctors and the site supervisor. But whenever I needed assistance because I thought I was doing something potentially incorrect, it was easy for me to be able to ask for assistance from them. So the environment of the location, it was a very positive and supportive one that allowed me to have a very good experience throughout these past weeks within this location. I'm just fine with that. This even helps me with the fact that I was nervous at first to be able to do anything. But after asking some questions, being able to get to know people, I was able to make my nervousness dissipate even more due to how positive and supportive the environment was for me. While at the location, I was able, besides doing regular prepping for the stations for new clients to come in, they showed me how to use the traction table for clients, how to set clients up with the EMS machine and ultrasound. When do I know which spots on their body I need to use the machines on? Even when the doctor needed it, I was able to use the regular muscle vibration gun on parts of their back in case they needed it to help smooth out their muscles and relax them. And while I was there, I learned three major things. One is that I was able to see and experience what it's like to use some forms of physical therapy and see some versions of injury rehab and to somehow work with the machines, giving me some idea of what to expect if I were to go to physical therapy. Along with that, I was able to see for a brief glimpse what it was like to file and write proper documentation for clients, in the case for insurance reasons, as well as being able to document their progress. Though I wasn't allowed to do it for obvious reasons, I was at least able to be shown and what to expect, which allowed me to learn how much more complicated taking down documents for clients really is, as well as being able for me to properly learn that no matter because I'm an intern, I need to learn when I can talk with some ideas and when I can't when clients are present. In terms of what worked for me, in my opinion, everything worked out fine. There wasn't a single moment where I was like, I don't think this is good for me or anything like that. I just had to break out of my nervousness to be able to perform them. To be honest, everything would just remain the same in my opinion. The only thing I would change would just be the fact of that I got too nervous and hesitant when I applied anything on any of the clients, and because of that, I spent too much time more than it should have. So I hoped I'd be able to in the next time be able to change not only how much I hesitate when I perform things with clients, but also realize, as previously stated, when to ask questions to give my ideas when the clients are not there, as opposed to some of the instances I did where that wasn't appropriate for me to do. Because of everything, I'm generally happy with the site. The entire environment was calm and supporting. The doctors and the employees were very easy to talk to and very open for me to ask questions on how to perform things, as well as have discussions as to how things should and should not be done. The main reason that I chose this site is because not only is it so close to my house, but it's also under the physical therapy category for the practicum. So this meant that I'd be able to get some experience as well as a letter recommendation for the physical therapy doctorate program at FIU as one of the prerequisites, as well as allowing me to have a brief glimpse of what it may be like to work in physical therapy. In terms of recommendations I would have for students, I recommend for students in terms of the practicum to just not be as nervous as you may think. This may seem like a daunting task with this practicum and finally getting internship experience if you haven't. But the more quickly you're able to ask questions and properly understand and calm down, the easier your time will be. And that any difficult moments you may have are just another stepping stone to be able to improve yourself once more. And the same can be applied to just this site as well. Everyone's open, the site supervisor is easy to talk to, and overall it's a very easy environment once you get the hang of it. You may be nervous at first. In the end, you'll be able to succeed. So I hope for any other students who take this site or in general, just don't be nervous, ask some questions, and remember everyone there is still a person. So just have fun and be able to learn what you may need. And good luck with yours.